For the purposes of attendance, the clerk will call the roll.
Campbell.
Here.
Connor.
Here.
Geiger.
Here.
Getty.
Here.
Here.
Jackson.
Here.
Smelter.
Smelter is absent. Approval of written agenda. At this time, any member of the board or member of the public may request an item to be removed from the consent agenda and placed under items for consideration. Is there any request from commissioners? Is there any request from the public to make such a move? If so, please unmute your microphone and make your request known. Hearing no such request and without objection, the agenda is approved as written. Reports from state and county officers. At this time, any state or county officer wishing to address the board may do so. I do have one. As chairperson of the Berry County Board of Commissioners, we have a special treat for honoring a special commissioner today. You guys want to come up? He was supposed to be in attendance in person today, or in the Titan Center. Now come on in. Grab a. Commissioner Gibson has been a loyal and faithful member for the Berry County Community Mental Health Board for 16 years. And this year he is giving up his seat to Commissioner Getty. So our friends at the Community Mental Health Board wanted to say a special thank you to Hoot.
Good morning, Hoot.
Good morning.
How are you?
Fine. How are you?
Good. I'm great. Hey, Hoot, can you hear me okay through my mask?
Mm-hmm.
Okay, great.
Yes.
We have a letter for you as representatives, and Bob Becker's here with me. As representatives of the Berry Community Mental Health Authority Board and staff, we would like to thank you for your ongoing support and service for the last 16 years. Your dedication and commitment as a board member has provided benefit for our organization as well as the citizens of Berry County. 16 years is a very long tenure, during which time you helped us navigate many changes and improvements. As you will remember, you were responsible for identifying a location for the Lighthouse on the Lake Drop-In Center. When they had client transportation issues, you helped minimize concerns by working with Berry County Transit. During your 16 years on the board, we retired our long-term executive director, Jan McLean, and our current executive director. Thank you. We opened our new facility at the current site. You were very instrumental in the successful ribbon cutting and open house when we opened to the public. There are many other contributions, Hoot, too many for us to list here. And for those in your ongoing support, we want to thank you. We will miss seeing you regularly as the early bird at meetings. However, we wish you well in the future committee interactions and hope you will stop by to see us when this pandemic has subsided. Warmest regards. And this is from me, from the board, from Rich Timke, and from Bob.
Bob, do you want to say that?
Yeah. Here you are.
No, I just wanted to say thank you. You and I were able to serve on a couple boards together, and you've been a mentor to me as I've begun my community service. And thank you very much.
And Hoot, we wanted to surprise you today. We really thought you were going to be in the Titan Center at 9 o'clock. And when we saw your Zoom background, we said, that's not the Titan Center. So there's a special token of mental health appreciation for you when you make it down to the courthouse. So
Thank you. I've enjoyed being on that board.
Thank you, Hoot. We appreciate all your time.
Thanks, Hoot.
Alrighty.
Yes.
Right.
Thank you.
I'll
Thank
send
you.
this to him.
Yeah.
Do you want this?
Yeah. So the next, further reports from state and county officers. We do have the health officer prepared to be here at 9:15. She's currently on another call. So if there's no objection, I'd like to put her after public comment and various correspondence. Without objection, the agenda is amended. Are there any other state or county officers wishing to provide a report? Limited public comment. At this time, any member of the public wishing to address the board may do so for up to 3 minutes. Those joining by Zoom should raise your digital hand now. Those joining by phone should dial *9 now. The administrator will tally the hands and announce the first speakers.
Mr. Chairman, I do not see any hands raised at this time.
Thank you, Mr. Brown. Last chance for public comment. Hearing none, we'll move ahead. Various correspondence. Does any commissioner have any correspondence they'd like to share with the board? I did get one letter from a individual from Hastings that wanted to speak today about why they believe Berry County should have night meetings. They quote the Bureau of Labor Statistics that says that there are 61,550 people in Berry County. With that, 63% of them are part of the labor force, and 84% of those work a day shift basis. So throughout this letter, this individual states that it's in the county's best interest to go to night meetings, and he hopes that the board gives it thoughtful study. Any other correspondence? Hearing none, consent items. Commissioner Getty.
I move to approve the following consent items. Approval of the January 12th, 2021 Board of Commissioners meeting minutes. Approval of the January 19th, 2021 Committee of the Whole meeting minutes. Approval of the attached 2021 contracts for Indigent Defense Council Services with Jackie Baker, Carol Dwyer, Shane Henry, Kristen Hull, James Kinney, Gordon Shane, McNeil, Catherine Russell, Stephen Stores, Lionel Woolley, and Kimberly Young. Approval of the purchase of goods and services quoted by BIS Company for the improvement, stability, uniformity of the audio video requirements of the courtroom in the amount of $12,154.75, with funds to be paid from the data processing fund. And approval for the court to purchase a portable court recording system in the amount of $31,734.
Second, Connor.
Motion by Getty, supported by Connor for approval of the items listed under the consent agenda. Discussion is not allowed and a roll call vote is required. All those in favor will vote aye. Those opposed will vote nay. Clerk will call the roll.
Campbell,
Aye.
Connor,
Aye.
Getty,
Aye.
Gibson,
Aye.
Jackson,
Aye.
Melker,
Aye.
Geiger.
Aye. The consent agenda is approved. Public hearings, we have none. Presentations, we have none. Public hearings, we have none. Items for consideration.
Mr. Chair, I move for the approval of claims in the amount of $126,527.17.
Second, Gibson.
Motion by Campbell, supported by Gibson for the approval of transfers and disbursements. Approval of claims in the amount of $126,527.17. Is there discussion? Is there discussion from the floor? Please unmute your microphone and make your request known. Hearing no such discussion or no such request, we'll proceed to vote. A roll call vote is required. All those in favor will vote aye. Those opposed will vote nay. Clerk, call the roll.
Connor,
Yes, aye.
Getty,
Aye.
Gibson,
Aye.
Jackson,
Aye.
Smelker,
Aye.
Campbell,
Aye.
Geiger.
Aye. Motion carries.
Mr. Chair, I move for the approval to appoint Deborah Jensen and Sarah Nelson to citizen at large positions on the Berry County Parks and Recreation Commission for terms that began on January 1st, 2021 and end on December 31st, 2023.
Support Jackson.
Motion by Campbell, supported by Jackson, for the approval to appoint Deborah Jensen and Sarah Nelson to citizen at large positions on the Berry County Parks and Recreation Commission for terms that began on January 1, 2021 and end on December 31, 2023. Is there discussion? Is there discussion from the floor? Please unmute your microphone and make your request known. Hearing no such request, we'll proceed to vote. Roll call vote is required. All those in favor will vote aye. Those opposed will vote nay. The clerk will call the roll.
Getty,
Aye.
Gibson,
Aye.
Jackson,
Aye.
Smelker,
Aye.
Campbell,
Aye.
Connor,
Aye.
Geiger.
Aye. Motion carries.
Mr. Chair, I move for the approval to appoint Dwayne Secord to serve on the Berry County Community Mental Health Authority Board for a 3-year term that began on April 1st, 2020 and expires on March 31st, 2023.
Second, Smelker.
Motion by Campbell, supported by Smelker, to appoint Dwayne Secord to serve on the Berry County Community Mental Health Authority Board for a 3-year term that began on April 1, 2020 and expires on March 31, 2023. Is there discussion? Is there discussion from the floor? If so, please unmute your microphone and make your request known. Hearing no such request, we'll proceed to vote. The roll call vote is required. All those in favor will vote aye. Those opposed, nay. The clerk will call the roll.
Gibson,
Aye.
Jackson,
Aye.
Smelker,
Aye.
Campbell,
Aye.
Connor,
Aye.
Getty.
Aye.
Geiger.
Aye. Motion carries.
Mr. Chair, I move for the approval to reappoint David Solms to serve on the Berry County Board of Road Commissioners for a 6-year term that begins on 1/1/21 and expires on 12/31/2026.
Support. Getty.
Motion by Campbell, supported by Getty, for approval to reappoint David Solms to serve on the Berry County Board of Road Commissioners for a 6-year term that begins on January 1, 2021 and expires on December 31, 2026. Is there discussion? Discussion from the floor. If so, please unmute yourself and make your request known. Hearing no such request, we'll proceed to vote. A roll call vote is required. All those in favor will vote aye. Those opposed will vote nay. Clerk will call the roll.
Jackson,
Aye.
Smelker,
Aye.
Campbell,
Aye.
Connor,
Aye.
Getty,
Aye.
Gibson,
Aye.
Geiger.
Aye. Motion carries.
Mr. Chair, I move for the approval to appoint Holly Pinero as recommended by the Berry County Humane Society to serve as the Humane Society representative for a one-year term on the Berry County Animal Shelter Advisory Board that begins on January 1st, 2021 and expires on December 31st, 2021.
Second, Connor. I want to say thank you for administration for getting the minutes from the Animal Shelter Board meeting.
Motion by, who seconded that?
Connor.
Motion by Campbell, supported by Connor, for the approval to appoint Holly Pinero as recommended by the Berry County Humane Society to serve as the Humane Society representative for a one-year term in the Berry County Animal Shelter Advisory Board that begins on January 1, 2021 and expires on December 31, 2021. Is there discussion? Is there discussion from the floor? If so, please unmute your microphone and make your request known. Hearing no such request, we'll proceed to vote. A roll call vote is required. All those in favor will vote aye. Those opposed will vote nay. Clerk will call the roll.
Smelker,
Aye.
Campbell,
Aye.
Connor,
Aye.
Getty,
Aye.
Gibson,
Aye.
Jackson,
Aye.
Geiger.
Aye, motion carries. Commissioner Campbell,
Yes.
can we pause just a second? Do we have the health officer on the phone? Colette, are you there? All right, we'll keep going.
Mr. Chair, I move for the approval to reappoint Michael Spangler to serve on the Berry County Veterans Affairs Committee for a four-year term that began on January 1st, 2021 and expires on December 31st, 2024.
Second, Gibson.
Motion by Campbell, supported by Gibson, for approval to reappoint Michael Spangler to serve on the Berry County Veterans Affairs Committee for a four-year term that began on January 1, 2021 and expires on December 31, 2024. Is there discussion? Discussion from the floor? If so, please unmute your microphone and make your request known. Hearing no such request, we'll proceed to vote. Required. All those in favor will vote aye. Those opposed will vote nay. The clerk will.
Campbell,
Aye.
Connor,
Aye.
Getty,
Aye.
Gibson,
Aye.
Jackson,
Aye.
Smelker,
Aye.
Geiger.
Aye, motion carries.
Mr. Chair, I move for the approval to reappoint the following members to serve on the Berry County Community Corrections Advisory Board for three-year terms that begin on January 1st, 2021 and expire on December 31st, 2023. Christine Heyer, Service Area Representative. David H. Tripp, Criminal Defense Attorney Representative. Amy Graham, Workforce Investment Board Representative. And Carrie Larrabee, Communications Media Representative.
Support Smelker.
Motion by Campbell, supported by Smelker, for approval to reappoint the following members to serve on the Berry County Community Corrections Advisory Board for three-year terms that began on January 1, 2021 and expire on December 31, 2023. Christine Heyer, Service Area Representative. David H. Tripp, Criminal Defense Attorney Representative. Amy Graham, Workforce Investment Board Representative. And Carrie Larrabee, Communications Media Representative. Is there discussion? Discussion from the floor? If so, please unmute your microphone and make your request known. Hearing no such request, we'll proceed to vote. A roll call vote is required. All those in favor will vote aye. Those opposed will vote nay. Clerk, call the roll.
Connor,
Aye.
Getty,
Aye.
Aye.
Jackson,
Aye.
Smelker,
Aye.
Campbell,
Aye.
Geiger.
Aye. Motion carries.
Mr. Chair, I move for the adoption of resolution number 21-05, Municipal Employees Retirement System Healthcare Savings Program Uniform Resolution.
Second, Connor.
Motion by Campbell, supported by Connor, for the adoption of Resolution 2105, Municipal Employees Retirement System Healthcare Savings Program Uniform Resolution. Is there discussion? Discussion from the floor. If so, please unmute your microphone and make your request known. Hearing no such request, we'll proceed to vote. A roll call vote is required. All those in favor will vote aye. Those opposed will vote nay. Clerk, call the roll.
Getty,
Aye.
Gibson,
Aye.
Jackson,
Aye.
Smelker,
Aye.
Campbell,
Aye.
Connor,
Aye.
Geiger.
Aye. The resolution is adopted.
Mr. Chair, I move for adoption approval of the attached MERS Healthcare Savings Program Participation Agreement for the Berry County Corrections Unit employees.
Support Smelker.
Motion by Campbell, supported by Smelker, for the approval of the attached MERS Healthcare Savings Program Participation Agreement for the Berry County Corrections Unit employees. Is there discussion? Discussion from the floor. If so, please unmute your microphone now and make your request known. Hearing no such request, we'll proceed to vote. A roll call vote is required. All those in favor will vote aye. Those opposed will vote nay. Did someone make a request? I felt a disturbance in the force. Hearing on the question before the board is approval of the attached MERS Healthcare Savings Program Participation Agreement for the Berry County Corrections Unit employees. Roll call vote is required. All those in favor will vote aye. Those opposed will vote nay. Clerk, call the roll.
Gibson. Gibson,
Aye.
Jackson,
Aye.
Smelker,
Aye.
Campbell,
Aye.
Connor,
Aye.
Getty,
Aye.
Geiger.
Aye. Motion carries. We do have the health officer here, but I am going to give her a couple of minutes to set up, if there's no objection from the committee. I think because of the treacherous roads today, she wasn't able to get to a place with good cell phone reception as soon as she'd like. So if there's no objection, we'll take a 5-minute recess until 9:30.
Sure.
All right, we're at recess. If you have questions pertaining to the COVID-19 response or anything, now's the time to write them down.
Good morning, John.
Good morning.
I heard from my daughter. She said the roads are awful, and she said that she was 15 minutes late getting to work. It's in Grand Rapids.
Now, we figure on leaving early to go, so.
Okay.
Board will come to order. At this time, we have Colette Scrimger, the health officer for the Barre Eaton District Health Department, to give us a report on the COVID-19 response, to take questions from commissioners, and also any individuals wishing to ask questions from the public. So, Colette, can you give us an update on what's going on?
Sure. Morning, everyone. Sorry that I was late. The roads were a little rough. I'm going to shut off my camera, though, so that I maintain my internet connection. Just wanted to say hello to everyone.
Oh, hello. It's really
So just to give you an update on where we're at in terms of COVID, things are improving in Barre County. Our numbers are looking positive. We're seeing a decline in cases for sure, both in new cases coming in, and then we're also seeing a decline in hospitalizations and a decline in deaths. And so that's all good news at this point in time in the situation. And so then the other thing that I just would talk a little bit about is vaccine distribution and give you some background on where we're at with vaccine distribution. We have been vaccinating since December 23rd. We initially received a supply of about 1,000 doses for the district that we used between December 23rd and January 18th. And then on January 18th, we received another supply of about 1,200 doses for the district, and the same for this week as well. So it's not as much vaccine as we would like. We certainly have capacity to distribute more, but that is what has been allocated to us from the state. Our hospital partners have received vaccine as well, and they have been able to push vaccine out through their system too. We are doing vaccine distribution out of our Hastings office currently. It is scheduled appointments, so no walk-ins, but scheduled appointments only. That allows us to make sure that we have vaccine supply on hand, and then allows us to space individuals out so that we can allow for social distancing within our building space. In Eaton County, we are also vaccinating. We switched this week to vaccinate at the Lansing Mall site. That gave us more space than what we had in our Charlotte office. We do allow people to go to either location. So we have many Berry County folks who are coming over to the Lansing Mall because that provided more options available to them than what our Hastings clinics did at the time. And vice versa. We have some people from Eaton County who are choosing to drive to Hastings instead. We continue at this point to plan on providing vaccines through our Lansing Mall site for Eaton County. And then in Berry County, what we are planning on doing is expanding our utilization of the space, reconfiguring our space within our Hastings office site in order to maximize the volume of vaccine that we can push through there. And then, but we are also talking about doing an off-site location in Berry County, perhaps on a once per week basis once the vaccine supply increases some more. So we've been looking at a couple different options. Most recently, we looked at the Ever After banquet hall that's near the Hastings office. And then we've also looked at the fairgrounds. We will probably use that Ever After location just because the parking and the snow and all that's a little bit easier there for our senior citizen population than being out at the fairgrounds. So those plans are still being finalized and are really dependent upon vaccine supply. So until we get, a larger vaccine supply coming in consistently, we're able to maintain the volume that we currently are getting at our Hastings office for the Berry County location. So more will come on that as we learn more about it. Just keep in mind that either location will always be appointment only. So, that everyone will have to have an appointment before they come to get vaccinated. Starting this Friday, we are going to switch to releasing appointments for vaccine on a weekly basis. So essentially what happens is that the state notifies us on Fridays what our allocation will be for the following week. And that allocation is usually delivered either on Monday or Tuesday. So, with that, what we intend to do is make a determination on Fridays based on the vaccine allocation we were given, what our clinic capacity will be for the following week. And the intent is that by the end of the day on Friday, we will open up the schedule and push an email out to all of the people on our contact list, a notification that appointments are now available. So that will start this Friday afternoon for the following week and then continue every Friday thereafter. The disadvantage to this system is it doesn't allow people to plan very far in advance. And we recognize that. But the advantage is that we are only scheduling appointments for vaccine that we know we will actually have. And so therefore we won't have to be in a situation where we'll need to cancel appointments because vaccine didn't come. We decided canceling appointments is not a good thing. And so we'd rather only schedule appointments for known vaccine quantity. So that's the direction that we decided to go. At least until the time that vaccine supply is more consistent and predictable, this is the way we will continue to do things. We are also working with Spectrum Penic on vaccine allocations and distribution. In fact, this past week, they did lend us 100 doses because our allocation was short. And at that point, we did have appointments scheduled. So to prevent us from having to cancel appointments, they did lend us 100 doses that we will have to pay back to them, with a future allocation at some point. So that helped us out a great deal and prevented us from having to cancel appointments for people who were anxious to get their vaccine. So Spectrum Penic has been working with us to assure that we're getting coverage to both the population 65 and over, and then also to the school population as well, the school teachers and staff that need to be vaccinated. And so that has been a good partnership to have, and we continue to coordinate with them to assure that we're reaching the people who are eligible for vaccine. I will pause there and see what questions you have for me.
I have a question.
Who? Go first.
I have a question. Are you going to finish the 1B group before you change groups?
So we are currently working on the groups that are designated by the state of Michigan as being eligible for vaccine. And that currently is a combination of 1B and a segment of 1C, because 1C included the 65 to 74-year-olds, but they moved them up into this current prioritization. So we will continue vaccinating that population until the state decides to change who is eligible for vaccine. So we follow, the state wants us to move together across the state through the cohorts. And so we will continue to vaccinate those who are eligible until the state tells us otherwise.
Okay, thanks.
Other questions from commissioners?
I have a question.
Oh, go ahead.
Let's go with John first because he has to leave possibly early, and then we'll go to Catherine.
Yes, Colette, can you tell me how many people have signed up in Berry County? Or don't they do it on a county basis?
Yeah, so in terms of so we have a contact list of people who are interested in getting the vaccine. And the last time I checked, that contact list was well over 20,000 people. I don't know the breakup between Berry versus Eaton County on that contact list. In terms of how many people have been vaccinated at this point by the health department, we're at approximately, the health department has vaccinated approximately 2,200 people between the first allocation we received and then last week. And again, I don't have the exact breakdown by Berry or Eaton at this point in time, just because people have been going to either location and we haven't been tracking it that way. However, as soon as we get through this next week or so of getting our clinics really going, then I will have some staff time that will dedicate to setting up some sort of dashboard or data report that allows us to report out on vaccine distribution within the district. So that is coming. It will be an update to our website so that people can kind of monitor how we're doing with vaccine distribution within the community.
John, thanks, John. Catherine.
Colette, you first vaccinated at the end of December. Those individuals will be eligible for their booster. Are you confident that the supply chain will give you enough to give them boosters on time?
Yes, so we've been receiving second dose allocations. The state sort of tracks those separately. So we, I believe at this point, we've received about 500 of our second dose allocation. And we started our first group of people who were eligible for their second dose were able to get vaccinated late last week, starting late last week. So we've done some, not very many because we just didn't have that many to do. But over the next couple of weeks, more and more people will be eligible, and we do have that vaccine available, at least at this point in time. My assumption is that will continue to happen that way, but some of this is really in the control of the federal government, and it's hard to say what will happen with that. But we're being told to count on being able to get an equal amount of second doses that we received of first doses.
Thank you.
I have a question, Ben.
Yeah, Vivian.
Sorry, I saw Dave's hand, but I was already up.
Ladies first.
Thank you. Colette, when you say 1,000 doses and then 1,200 doses, and you said by district, so is that evenly split between the two counties, Eaton and Berry, because individuals can go to either or place to get their vaccine?
Not necessarily evenly split because Eaton County is twice the population of Berry. So, we have more people to vaccinate there, but it's proportionately split, yes.
Thank you.
Okay. Colette, David Jackson. Question, you had mentioned, I think, that thus far we've got 3,400 doses in the district, but it sounds like the health partners like PennOC are also receiving some doses on their own. Do you know how many doses are in the district for total right now, in addition to our 3,400 that the health department's received?
I don't have that number specifically. There is a state website that tracks information on the doses that were allocated to different entities and then what was, administered. I will tell you, though, that there's a lot of problems with that website right now in terms of being able to distinguish where people were vaccinated, when the allocation came, the second doses and how that plays into it. So right now it's not the cleanest system to look at. And, that's what we're still trying to learn from the state. How are they defining the data on that website so that we could assure we really understand it before we're pushing it out to our community too much. So there's still a lot of questions on that. And that's just something that we're getting there. We're just not there yet. But the piece to keep in mind is that when you're looking at our district or at either county, is people can get vaccinated anywhere for the most part. So anyone who's offering vaccine, you can go and try to get vaccinated through them. So many Berry County residents have been able to get vaccinated in Grand Rapids, as an example. And many Eaton County residents have been able to get vaccinated in Lansing. And so when you look at numbers, it doesn't necessarily correlate to how much vaccine has come into, say, the health department and PennOC Spectrum Penic. In addition, Spectrum as a system has been, even though there's allocation that comes to Spectrum Penic specifically at times, I believe at times Spectrum Penic has pulled some of that vaccine back, but then at other times Spectrum has also pushed vaccine to Penic that they might not have received otherwise. And I don't have a way right now to be able to track those kinds of numbers, but hopefully we will get to that to be able to know what vaccine has actually been available to our community and how many people in our community have been vaccinated.
Yeah.
So hopefully within the next couple of weeks, we'll be able to get you better data in that regard.
Okay. That's good information to know. Just at 1,200 doses a week, it would take us 3 years to vaccinate the population of the 2 counties. But if PennOC is getting doses and the other healthcare providers within the district are, and people are going outside a district to get it, then, I don't know if they had a realistic expectation on when they would hit that 80-85% mark as far as people being vaccinated in the district.
Yeah, so I also should mention that in addition to Spectrum Penic and the health department getting vaccine, there's also been vaccine coming in through the federal long-term care partnership program, where the federal government established a contract with Walgreens and CVS to vaccinate residents of long-term care facilities or congregate living settings and the staff that work there. So there's also been vaccine coming into the district just through that program as well. So they've been targeting, like Thornapple Manor and other long-term care facilities like that, but also other places like assisted living facilities, adult foster care homes, those sorts of places too. So that's another source of where vaccine has been coming in, greater than the number of doses we're getting at the health department, for example.
I appreciate that. That sounds like a beehive of information and activity. Let your staff know we appreciate their efforts in working 7 days a week to see this through. We know it has been a long year for you guys over there, but we certainly appreciate everything you're doing to make this work.
Thank you.
Bruce, do you have any questions?
No, but I might add, Chairman, that the Veterans Administration is also distributing nuts.
Thank you.
Mr. Chair, at the last EOC meeting, Lynn Briel shared that Thornapple Manor has gotten their second, their booster, and that was done by Walgreens. So for staff and residents.
Thank you.
You're welcome.
I have a few questions, Colette. Why did it seem to take so long to secure a Berry County location?
We've had the health department site going since December 23rd. So we've been giving shots out of our office from the beginning on a regular basis, and plan to continue to do that. What we struggled a little bit with in Berry County was trying to decide at what point, based on vaccine supply, do we think we need an off-site location, and where should that be? We spent a lot of time trying to identify a drive-through location because we were thinking that would be the most ideal situation. That's what several communities have been doing, is something where people just don't even have to get out of their car. And that, ended up being challenging to secure that. And so then we started looking at some other options, and, there's lots of choices, and it just takes staff resources to be able to go and assess that and figure out if it's the right fit. And so, so between that and then just some bad leads that we had initially of a couple locations, that's just kind of made it take a little bit longer than it probably needed to, but it's also okay because we aren't ready yet to open up an off-site location. We don't have the need to open up an off-site location in Berry County just yet because the vaccine supply just isn't there. So what we're able to do out of our Berry office, we can expand the capacity that we've been pushing people through in our Berry County office to more than double what we've been doing. So we have some room to get that going before we'll really need an offsite location. So, and then because we had sort of this fall in our lap in Eaton County to have the Lansing Mall offer the space that they did at no cost, we focused attention on getting that going, knowing that that could be a resource for the whole district as well. And, decided to use that as our pilot case of what would an indoor site look like. And then how can we replicate that at a location in Berry County? And so it's worked out well because now that we have the experience at the Lansing Mall, we know a little bit better of what to look for in a site, and that Ever After location will be an ideal location for that. And the fairgrounds can also easily accommodate the model that we're using at the Lansing Mall.
Thank you. The next question is, are we letting any vaccine go to waste? Or do we open these vials and not have anybody to administer the vaccine to?
No, we're very carefully managing these vials and down to the dose. And so, so that's why everything is scheduled. And then we also have a system where if we end up with a no-show, or the other thing that happens is some of the vials produce an extra dose. And so when that happens, we account for that and we make sure that we get that vaccine in an arm. And we have a couple different things that we use, but the main thing that we've been doing is we maintain a list of people who have offered to be sort of on call for a vaccine. Typically they live close to either location and they're available at short notice, and they're eligible. So they're still eligible for the vaccine, and but they're willing to come in at the last minute if we have the situation where we have an extra dose or a no-show. And so that system has been working pretty well, and we've been able to make sure that no dose gets thrown away.
Great. So the Whitmer administration has developed a plan for the state that says once healthcare providers have vaccinated their workers, the organization is supposed to reach out to other independent health care providers. Is that correct?
Yeah, that was part of the 1A group. So that was the initial group that we did. We worked with our hospitals to make sure that they got their staff vaccinated. And then we reached out to all sorts of healthcare workers across the district, private doctors' offices, dentists, physical therapists, the whole gamut of healthcare providers that were having patient contact. And we offered them appointments either through us, or we were able to connect them through the hospital system to get vaccinated.
And did the Whitmer administration ever provide a list of that or database of those contacts? I was hearing that database was supposed to be put up and it never was.
So we, some of those contacts we already had locally. I mean, that's part of our preparedness planning, was to assure that we had lists of doctors' offices and other dentists, et cetera. So some of that we already had and didn't need them to provide that to us. But there were different groups of individuals of lists that the state did push our way that we cross-referenced with what we already had on hand.
Great. Businesses can open up at 25% capacity on the 1st. Is there any special message you'd like to send along to Berry County businesses? They're sure hurting, and this is some welcome news.
Yeah, just that I hope that they will continue to take all the precautions that they can. We're not out of this completely yet. There's still enough disease circulating in the community that everyone should still be cautious so that we don't, have another surge, essentially. And then so we want businesses to follow the safe practices that have been outlined and do what they can to reduce spread.
Great. And just to reiterate before I move on, the ability to register for, or the ability to schedule an appointment to get a vaccine through your health department is going to open up on Fridays typically, correct?
Right. So the process is that somebody has to fill out the interest form on our website that sorts them into the priority group. And if it determines that they are eligible for the current priority group, then they will get a link to a schedule to try to schedule an appointment.
Mm-hmm.
If they filled out that form today, when they try to schedule the appointment, it's going to show that no appointments are available. So, because we're booked for the week. However, everyone who fills out that interest form, if they put their email address in there, then on every Friday afternoon going forward, we will be sending an email to all of those people on the list who are currently eligible for vaccine with a new link to the schedule. And that schedule will show open appointments for the following week. The key piece to keep in mind, though, is that that list, as I said, is thousands of people that are currently eligible. And each week at this point, we're only able to offer about 1,000 appointments. So there's, a big discrepancy between supply and demand. And so it will take people time to, several weeks before they're able to get in for an appointment. As more people get vaccinated, then more opportunity will open up. Or as the supply of vaccine increases, more opportunity will open up.
So for individuals that are having trouble registering on the site, is there something that we as commissioners can do to facilitate that? If we get a request saying, hey, can you add us to the waiting list?
Yes.
Can we see your department?
Yep. So a couple options for people who don't have internet access or might have difficulty managing this process, then I encourage that they call. I can give the phone number. It's 517-541-2605. Or they can call either of our offices, but the direct number is the 517-541-2605. They will most likely end up leaving a voicemail. And as long as they let us know that they don't have internet access and they, or they're having difficulty with the process and leave their name and contact information, then what we will do is add them to our list of people who we will call when appointments become available, and do more of a direct connection with them instead of them having to go through the website scheduling. However, I will tell you that the fastest way to get an appointment is going to be to go through the automated process. So this list of people we call is not a way to bypass that. Right. You're still going to be facing the same constraints of appointment availability as everyone else. And so it's not a shortcut to get, to the head of the line.
Okay.
But we've been working with the Commission on Aging, who has been helping us schedule these appointments, but we have a long list of people who fall into this. But again, we're limited by what appointments we have available for them.
Is the COA going to be a distribution site?
At least not at this point in time. We're not planning on vaccinating out of their office. Perhaps when the supply increases, we will make arrangements to do that. But at this point in time, they've been helping us handle some of the outreach to the 65 and older population and have been helping us schedule some appointments. And, I just want to mention that we've been staffing some of our clinics, especially the Lansing Mall ones, and we'll start doing this in Hastings office as well with volunteers from across the community. We've had great support from the community with our vaccine clinics. So, and even currently some of our Berry County volunteers are coming over to the Lansing Mall to work it. And the feedback we've been getting from them has been just incredible. They're so happy with how things have been set up, so happy with being able to contribute to such an important cause, and just very thankful for the opportunity. And we're so thankful for them because we couldn't pull this off at the volume that we're doing without the assistance of the volunteers. And so it's been great to see that community support for the health department and getting these vaccines out the door.
Our county clerk has a question about, is there side effects with the vaccine we're giving out?
There can be side effects with the vaccine for individuals, especially after the second dose of the 2 vaccines right now. So people tend to see fewer side effects with the first dose, just your typical arm pain kind of thing, though some people might feel some mild fatigue or something along that lines. But we do hear about more side effects with that second dose of, some people will run a temp for a day or experience almost like that COVID-like symptoms. However, it's not a bad thing. That's a good sign. It's an indication that your body is using that virus to learn about what it needs to do in order to fight, or it's using the vaccine to learn about what it needs to do to fight off that virus. So it's not a bad thing that there's side effects, and they're typically mild enough and they go away typically after a day.
I don't have any more questions. Commissioner, any other questions from commissioners?
I have one more question. There are several vaccine registration sites out there. You can, you've alluded to those with the hospital systems. I just wanted to make clear that you can sign up for more than one registration site in an effort to get your first available appointment. But in talking to Colette earlier, we want to make clear to people to only make one appointment so that you don't tie up vaccine.
Yes, thank you very much.
Questions from the floor? Any member of the public wishing to ask a question, please unmute your microphone now and make your request known. Any requests from the floor? Seeing none, we'll move ahead. Thank you, Colette.
All right, thank you.
How are we doing, commissioners? We need a break?
Let's finish this up.
Good here.
All right. We have no unfinished business. We have no new business. County Administrator's report.
I'm all set, Mr. Chairman. Thank you.
Chairperson's report. I just want to ask commissioners, how did you like doing the multiple interviews at one time for the cows?
I liked it.
Think we're probably going to have to improvise doing these things virtually. So I thought that was a good option. Miss seeing everybody face to face, but we have to do what we have to do right now. So
thanks. Next week.
I personally thought it was just fine when we're doing it virtually also, Ben.
Well, getting a compliment like that from John Smelker just makes my day.
Don't get used to it.
Don't happen often, does it, Ben?
Next week, I've talked with some of you about making our meetings so we can deliberate or talk about things that necessarily aren't on the agenda that are emerging. So next week, I'll have a proposal for now about tweaking the end of our Board of Commissioners meeting and the end of our cow meeting. So stay tuned on that.
And you were
Vice
kind of,
Chairperson.
wait a second, you were kind of garbled. I didn't quite get the last part of that.
Next week I'll be putting to the cow a proposal to allow for a commissioners roundtable to discuss issues not on the agenda. So if there's emerging issues or something has happened in the community, right now you have to wait every other week. This will allow commissioners to, bring that up at cow meetings. And also it'll be a time where you can ask questions to each other and to the administrator, like, hey, what's going on with this? What's going on with that? Just kind of an informal discussion period to make sure we're all on the same page.
Okay, thanks for restating that. Just kind of the end got kind of garbled here.
Mm-hmm. Great. Vice Chairperson's report.
Thank you. I've attended the Conservation District meeting since our last meeting. These are what has happened. They approved their annual meeting date of May 12th. They have approved renewal of their lease on DNR land in Nashville for another 5 years. Fallon Januska has applied for a grant to treat that invasive Mila minute weed. I talked about that quite kind of at the end of last year. I'm sorry. She should hear in March if she's been awarded that grant. The big thing is tree sale orders are available online at www.berrycd.org/home/services/trees. And also they have a Facebook page, https://fb.me/e/ehny9f24, which I give Pam Palmer a copy of my report every week. So it'll be a part of the board packet and you can go online also.
Maybe you repeat that URL, my pen, one more time.
I'm sorry.
Joking, I don't need to repeat that website.
Oh, as I said, Pam Palmer gets a written report from me, so it'll be a part of the minutes. But get on, if you need trees, get on there. Get your orders in now. Tree sale pickup dates are April 30th and May 1st. Yankee Springs Township, I attended the first meeting there. They're still trying to work out if their little township park should have more pickleboard courts and if that's appropriate. They're having some short-term rentals with houses in residential areas. They're having some issues with those, so they're going to be talking about those at their joint meeting with the planning board. They hired a new sexton and a new recording secretary. Jan Lippert was reappointed as the Yankee Springs Township representative to serve on the Gun Lake Improvement Board. And they approved not to impose the additional 3% penalty fee for any property taxes paid on or after February 16th, 2021 through March 1st of 2021 for the 2020 tax year. That's a lot of 2020s. Okay, solid waste oversight. We had a second subcommittee meeting to continue to create a position description for a recycling coordinator for possible RFP. We finished a rough draft and it will be put in a final draft for the subcommittee review and then on to the actual solid waste oversight committee for final determination. And lastly, this morning, the Board of Public Works met at 8:01 to elect officers for 2021. I was reelected as chair, John Smelker was elected as vice chair, and Jim Dull was reelected as secretary. And that's all I have. 53 days to spring.
Thank you, Commissioner. Let's go to Dave Jackson.
Good morning. What we've been working on a lot so far in January is the combination of the new Economic Development Advisory Board and the Chamber combination. So we had a governance board meeting on Wednesday, the 6th of January. The following Wednesday, we had the regular EDA Advisory Board. working on kind of putting a feel to that as far as who's going to be in charge of what segments of that. There's a lot of buzz. There's a lot of excitement about the new system and the new setup. It's just a matter of implementing it. So the governance board is meeting again on Wednesday, tomorrow, and then we have a health board meeting on this Thursday as well that some of us will be at. So we've been busy with that, kind of feeling our way through that and getting that set up. But like I said, I think there's a lot of good things coming. Also had a brownfield meeting on the 13th as well. Still working on brownfield assessment grants. And there's been considerable interest in that and a lot of good things happening in the county right now, starting out this spring. So, but that's it. Thank you.
Thanks, Dave. John Smelker.
John, you're muted.
I'll go.
All right. Who? You can go.
Yes, we had an organization meeting at the Transit. I was elected chairperson. Craig Stolzenberg was elected as vice chair. We're presently doing a management performance appraisal on the manager. Ridership is currently about 4,900 per month, including school students. The Transit has received their Section 5311 federal operating grant for 2021 in the amount of $280,703. CARES funding due to the COVID epidemic is expected to double that amount in supplemental forms. Berry County tax levies are starting to come in, and the Transit had received $50,000 so far this year. That's all I have.
Thanks, Who. Dave Schinnever, can you unmute John Smelker? I cannot. He seems to be stuck on mute.
I can request it to be unmuted. Let me see.
There he
He's
goes.
unmuted. Yeah, I couldn't get you unmuted.
Yeah, I'm back. You ready?
Oh, we're ready.
I just had a 911 meeting yesterday. We're moving ahead with a contract with Vander Cody Construction for the remodel. Lanny Forbes was elected chair, re-elected chair. I was re-elected vice chair and appointed chair of the finance committee. And we have health department coming up Thursday and airport Wednesday. That's it.
Thanks, John. Let's go with Bruce.
Good morning. I had a public works meeting this morning with Vivian, and she's already covered that nicely. And also I had a special meeting with Don Haney from the Thornapple Manor and Tim Click from DHS, kind of giving an introductory to their entities and what they do out there. And a lot of excitement over at Thornapple Manor with the assisted living coming about out there in the building that's going to be going on. So kudos to those two guys. They seem like awful good guys, and they gave us a really nice rundown of what they do. That's all I had.
So how are you getting through your first month? To what you expected?
Well, it's I've met a lot of very interesting people that I never really was aware of in the county before, of how much it takes to run a county like Berry County. And I can also see that we have very, very good leadership in our county and all the entities that I've been involved with so far. But very exciting, a lot to learn, but enjoying every bit of it.
Great. Thanks, Bruce. We'll go to Catherine.
Morning. I had my first mental health board meeting. I will have some big shoes to fill there. Thanks, Hoot. But there's a lot to learn with that board. I don't think I've ever seen so many acronyms, but they're gracious in providing a cheat sheet, and I will be referring to it often. Yeah. We had our annual recipients right for mental health recipients training. That was enlightening. And just learning more about what the mental health board offers. It is a tremendous resource in our county, and I hope that that everyone takes a few minutes to learn a little bit about that if you haven't already. I attended a West Michigan Regional Planning Commission meeting on the 15th. They reviewed an audit. The audit was clean, and they elected new officers. They had a new chairperson, Dave Hodges, and vice chair and treasurer, Roger Elkins and Paul Bullock. I also attended the LDFA meeting, Local Development Finance Authority meeting in the Village of Middleville. There were new leadership elections there as well. The big news there was that they had, the village had written a grant request through the EDA for the wastewater treatment plant upgrade, and that was not awarded. So there will be some additional funds that the village will have to come up with to proceed with that project. I was appointed to the Broadband Expansion Committee, and it's my understanding that committee has not met in some time, and so I'm trying to reach out to anybody that has information on who was on that committee, what they met on, or get some minutes, just get some history there, because I've had interest from Berry County residents about where we're at with the different partners that are bringing broadband into our residents. And then we have a Berry County Parks and Rec Commission meeting this week. And so I look forward to that meeting. One of the big items on the agenda is a campground proposal. We initiated a conceptual plan for a campground at Charlton Park that had been discussed for years and years. And so I'm anxious to get some feedback on that.
Thanks, Catherine. When it comes to the Broadband Expansion Committee, that's really whatever your vision is. Restarting a committee that you're appointed to, you're in the driver's seat for shaping that agenda and bringing in anybody that you'd like to. So I'm sure we could find useful information, but in terms of membership and structure, it really is a board-led organization. So yeah, feel free to shape in the way you see fit and reach out to those you think that could be helpful. How are you liking your first month?
I'll echo Bruce's comments. It really, I've worked across the county on many boards, but it always amazes me that I can, meet new people and find new people in leadership that you didn't realize were out there. And so it really does take so many people to bring success to Berry County. And I'd love to compile a list of how many people are out there serving on boards. We just went through all those appointments, and it really is amazing the number of volunteer hours that go into this.
As our friend Rick says, there are no strangers, only friends we haven't met here in Berry County. So thank you, Commissioner. Limited public comment. At this time, any member of the public wishing to address the committee may do so for up to 3 minutes. Those joining by Zoom should raise your digital hand now. Those joining by phone should dial *9 now.
Mr. Chairman.
Mike Snyder.
Yeah, good morning. A couple of things on your reports. I didn't hear anything that was going on with the city of Hastings. Of course, there's a lot going on with regards to the apartments and so forth. And I thought it'd be nice if the county was, kind of updated on what is going on with the city. And also, as far as Middleville, is anybody reporting on what's happening over in the Middleville district? Other than that, though, there's just two things that I just wanted to bring up this morning. Thank you.
Thank you. Is there further public comment today? If so, please unmute yourself and make your request known. Is there further public comment? Hearing none, we will, Michael, do you see any hands? I do not.
No, I don't see any. I only note, Mr. Chairman, that a caller at ending in 4127 pops up. I don't know if they're trying to connect or if it's just background noise that's.
Well, I don't think they are taking us up on the opportunity to comment.
Otherwise, I don't see any hands raised.
Okay. Is there any other business to come before the board? Hearing none, and without objection, the board will now adjourn.